नमः। सर्वे भवन्तु सुखिनः, सर्वे सन्तु निरामयाः, सर्वे भद्राणि पश्यन्तु, मा कश्चित् दुःखभाग् भवेत्. With this, good morning and namaskar one and all. Happy New Year 2021. May your life be as bright as sun, as beautiful as flowers, and all of you be showered with blessings and happiness. Well, I have the privilege of being your host for today's web conference. Myself, Dr. Bhapil Sharma, welcoming you all for today's web conference conducted by Shiva Ayurvedic Medical College and Hospital, Bilaspur, Himachal Pradesh. This is my immense pleasure to introduce Dr. Satish Pai, Associate Professor in Department of Dravyaguna at JSS Ayurveda Medical College, Mysore. Sir has done his UG from Ayurveda Mahavidyalaya, Hubli, Karnataka. Sir has done his PG in Dravyaguna from Government Ayurvedic Medical College, Bangalore. Sir has been Research Associate, Center Coordinator, and Principal Investigator for various research projects and published 21 scientific articles. He's a recognized PG guide and guided many PG scholars for their thesis work. Sir has worked as a research associate in Department of Pharmacology and Toxicology in Hebbal, Bangalore. Sir has been member of Ayurveda faculty in Rajiv Gandhi University of Health Sciences, Bangalore. Presently, Sir is working as an associate professor in Department of Postgraduate Studies in Dravyaguna, JSS Ayurvedic College, Mysore. Today, Sir is going to inform us about the research methodology, conceptual and applied. Dear audience, research methodology and medical statistics are an important tool to keep a check on the research projects undertaken in the medical field. Ayurvedic principles and medicines should also be time-tested and confirmed by application of these tools. Universal acceptance to Ayurveda is only possible after sound research with the help of modern research techniques. Hence, knowledge of research and statistics is important to every Ayurvedic student, every Ayurvedic researcher, and every Ayurvedic professionals. So before starting, I would like to thank our Managing Director, Engineer Purushottam Sarma, and Dr. Harsha NM, Principal and Medical Superintendent, Shiva Ayurvedic Medical College and Hospital, Bilaspur, Himachal Pradesh, for arranging this guest lecture session. So without any delay, let us start our today's session. Over to you, Dr. Satish Pai, sir. Welcome, sir. The platform is all yours, sir.
I hope my friend Dr. Harsha will speak few things before I start.
Yeah, welcome to you all. Hope I'm audible to you all. It is again, as Dr. Bhapil Sharma told, it is my immense pleasure to have Dr. Satish Pai amongst us, who is a, by his biodata as detailed by Dr. Bhapil Sharma, all of you must be aware by this time at how resourceful he is. But I have the personal, experience of working with him, and I have got to know a lot more about his intelligence and his applied, his ability to apply the knowledge and research and his acumen in research. So, since this was only the second lecture in the series of lectures on research methodology. The first one was by Dr. Nataraj way back, wherein he dealt with data mining. So after that, we could not have a better person than Dr. Satish Pai, who could enlighten our students and all of us regarding basics of research methodology and its applied aspects. And he's also into a lot of should I say? Like he has submitted a lot of research projects in university levels and even higher. So he would be knowing more about the practical aspects of research and formulation of research protocols and whatnot. You know, so we look forward to Dr. Satish Pai to deal with all these things, and I hope this is going to be enlightening for each one of us. No, I now welcome my dear friend Dr. Satish Pai to deal with the topic.
Good morning and very happy new year to all of you. And I hope without Dr. Harsha's few words, I cannot start my lecture. So it is because of his constant pressure and with lot of delay, I have agreed to have some few words and to share few information with you. Now, the thing is, I have gone through the syllabus also. The syllabus which is meant for the fourth year BAMS is just a fundamental to give some glimpses of research and research aspects. That is just a start to give a boost or to start a research because the undergraduate scholars in future, they are going to pursue the post-graduation and the research methodology and medical statistics, and they are the part and parcel of the curriculum. And without the knowledge of research methodology, once you enter the PG courses or postgraduate courses in future, it would be a bit difficult to understand. That's the reason why the apex body has placed this particular subject in your curriculum. I hope all of you will be keen to know about the research and very much fundamental aspects of research methodology. Now, before I start, let me mention a few things like research. When this word we listen by somebody, few things, few pictures come in front of our eyes. Like somebody, a person, age-old person wearing a white coat, standing in the laboratory holding a conical flask, having a colored solution in the conical flask and shaking it. Isn't it, Dr. Harsha?
Yeah, absolutely.
This is what the idea we have regarding the research. Research is not something which is done in the laboratory. Research is everything, anything and everything which can be done in day-to-day life. Very thorough investigation regarding anything can be taken as a research or considered as a research. So let me just continue with these few slides what I have prepared for you. Now, you are seeing the picture and the slide, the apple which is falling on Newton's head. And one particular quote has been mentioned on the left hand side of that. These questions are always guaranteed in life and answers are not. That means that is because the apple fell down on the Newton's head. It is what we were told when we were students. And it made him to think about the nature of gravity, and then he proposed many theories regarding gravity. So research always, which starts with the inquisitive mind. It is called as inquisitive mind. Only those people having inquisitive mind, only those people can think something about the new thing. So the definition of research is the systematic collection, description, analysis, interpretation of data to answer a certain question or solve a problem. See, this is a complete definition of research which has been mentioned. I repeat, the research is nothing but it is a systematic collection, description, analysis, and interpretation of data to answer a certain question or to solve a problem. Now, whenever we have a problem, it is told that is the problems or a necessity is the mother of invention. So whenever there is a necessity, the inquisitive mind, the people who have, they start thinking about what can be the solution or what could be the solution for that, and the research begins after that. And I particularly speak about the biomedical research. The research can be anything. Research is even the counting the potholes which are present on the road and how many potholes are there, and what was the time lag or a time frame since when these potholes have been formed. This is also a kind of research, right? So particularly we have to think about the biomedical research, and in biomedical research lots of things, lot of research has been taken place since the World War II, and you people know that the World War II had was so deadly and so fatal for the human race at that time. The millions of people died. They not just died because of the war or the effect of war. The people had died in those days because of the scarcity of the grains, because of the spreading of some epidemic diseases also. The people died, and most of the diseases, most of the researches which have been taken place in biomedical research, especially which happened during World War II, and one of the research which was very much helpful for the human beings, which happened in the field of medicine, was the development or the discovery of penicillin. That is the first ever known antibiotic. So, hope you understood the definition of research. Now, there is a myth. As I told, the research, the word, when we listen it, we get a picture of this particular person, what you are seeing that on the screen. That is a person or a researcher who is having a color solution in the conical flask. But it's a myth. So publishable research never, it does not need a well-equipped modern laboratory. Research which had been done, the Ayurveda itself is a big research. Okay, what we are studying, this particular subject, the Ayurveda itself is a big research, and there were no big universities, big laboratories in those days. Even forget about those era. Even the discovery of the radium, the radioactive material, that is the Marie Curie and her husband, who invented this particular radioactive elements. The invention took place in a cowshed. Okay, those people, they did not have they did not house also. The research, everything they did in a cowshed. So the myth we should understand: the research never requires a well-equipped modern laboratory. The thing which is first required for the research is the inquisitive mind. So if when you observe something and you start thinking about what may be the possible reason behind it and what may be the possible solution for it, that particular problem, so that will be the fundamental aspect for the research. Now, there are various steps involved in the research, especially think about the biomedical research only. We need not think about other things. Only the biomedical research, always the steps, it begins with the observation. The observation, when we observe keenly the things, then only we come across many problems around us. Those many problems may be related to the health aspects. The present problem which is going on is the COVID-19, right? So we are the inquisitive mind, people start thinking about the possible remedy for that. And many drugs, even the vaccine which has been coming out for the treatment of this COVID-19 is also a part and parcel of research. So first of all, the research starts with the observation. What we need to observe, the problem need to be observed, and then we need to form a hypothesis. So students, please note, these are the steps involved in the research of the biomedical research. So it starts with the observation. We have to observe the problems, we have to investigate it, then we have to lay the hypothesis. Hypothesis is nothing but it is in our idea regarding what may be the possible cause or what may be the possible answer or what may be the possible remedy. For example, Guduchi can treat Jwara is a hypothesis because it is not yet established. We have not done anything about it. No clinical trial has been conducted, no experimental trial has been conducted. We just think because we have observed the animal which is suffering from or which is having fever, the animal has grazed, and along with that particular grass and all, even the guduchi, that particular winner or a creeper, is also been grazed, and very next day the animal is free from the jwara. So the people having inquisitive mind, they have observed it and they suspect that that particular plant may be the reason which has given the remedy or which has solved the problem of that particular animal, because most of the Ayurvedic research has happened in those days by observing the animals only, because animals have a very good instinct compared to human beings. They use their instinct. One of the example I can give, in 2006, perhaps Dr. Harsha also knows it. In 2006, there was a natural calamity which happened in the east coast of our country, that is tsunami, which started from Indonesia, and the big waves, they just slapped along the east coast of our country, including Chennai and Visakhapatnam, till Kanyakumari. Even in Sri Lanka, many people died. But it was observed and it was reported in those days that the wild animals, however, near this particular coastal area, the wild animals, however, they escaped this natural calamity. The death rate of this wild animal was very less, because minutes before this, the tsunami waves came around the Sri Lankan coast, this wild animal have already escaped from those areas. Now, from where this particular instinct comes, in animals do have very good instinct, and regarding the health problems also they have the instinct. It's not that they know about the remedy, but they, however, find the possible solution for their problems. So the human beings, what they do and what they did in the past, they have observed what the animals eat, what the animals graze, and especially during their ailments, and the effect of those particular drugs or those particular medicinal plants on animals. They have studied, they have observed, and then they started thinking that that particular drug may be the reason behind that particular effect. That is, Guruji may be the reason behind Dwaragna karma. This is called as hypothesis. Hypothesis is always a initial imagination what we have in our mind. So we predict something. So after hypothesis, we predict, yes, we can use this Guruji for Dwara. I am just using this Guruji as an example. You can take anything as an example. Okay, so Guruji is an example I am just telling you. So we predict that Guruji may be, or Guruji can be used for Dwara, and then we start experimenting them. See, the third step, the first step is observation. I have observed. Then I have seen a problem. I have observed and I imagine that, but I have found a solution for the problem. Then how to say that that itself is a solution for the problem unless we experiment. Unless we experiment. Nowadays, that's a big problem. We cannot experiment directly on human beings. We have to prove the efficacy of the drug by using experimental animals. The human studies comes thereafter. Okay. The experiments need to be conducted by using the experimental animals. The experimental animals may be the rats, mice, frogs, rabbits, etc., etc. Then, when we are confirmed or we are pretty sure that this particular drug is acting for the ailment, then we start giving it for the human beings. That is called as clinical trial. We never use the word experiment for humans. It is called always, that should be called as clinical trial, and we observe the results. We analyze the results. And we repeatedly do the same experiments again and again. Why? Because one of the aspects of the research is always called as repetition and reproducible results. Okay. This please you mention in your notebooks. The one of the aspect of the research or one of the aspect of the good research is always the reproducible results. When you do the same experiments again and again, when you do it for 10 times, at least for 9 times, you should get the same results. So that is called as consistent results. When you get the same result, we say the consistent results. If the results are consistent, then that particular hypothesis, what has been postulated, what we have imagined, that becomes a theory or that becomes a established science. Or else, if the results are not consistent, then we can modify the methodology. It's not that always we will get positive results. There are negative feedbacks are also possible. So when we do not get the positive results, it's not that we have to stop experimenting. We can continue experiment, but the new methodology or a modified methodology, again postulate the hypothesis, again predict the results, conduct the experiments, then see whether the results are consistent or not. Then if the results are consistent, it publish it and you make it as an established science. So these are the different steps which are involved in the research areas. So again, this is just like the picture which depicts the chakra and the different arms connecting the axis of the chakra, that is the observation. You need to put the question, investigation, investigate the known facts, articulate expectations, carry out study, interpret results, reflect on findings, and then communicate the findings. See, unless, what do you mean by communicating the findings? Communicating the finding is nothing but whatever the results we get, or whatever the consisting or a consistent result we get, those consistent results should be shared with the scientific fraternity or a scientific community. Unless we share our knowledge or unless we share our experiences with the scientific fraternity or scientific community, it cannot be called as research, because when I experiment, when I do the research, that research may be good or bad. That research may be correct or incorrect. When who has to tell me whether my methodology is correct or incorrect? It is the learned people. It is the experienced people. They need to tell me about the quality of my research. So I need to communicate with the learned people. I need to communicate with the scientific community. My results must be published in reputed journals. Only then I may get some of the comments. When I get the comments, maybe positive or negative comments, it gives me the idea to modify the content of my research. Unless I get the negative comments. It's not that always I get the positive comments. Definitely, when the research is conducted, there will be the two things which are possible. The people may praise, people may ridicule. So ridicule is nothing but I might have committed some mistakes during the time of research, and those mistakes can be rectified. So that's the reason why after every research, that particular research findings must be communicated, must be published in the reputed journals. Now, little bit elaborated way, if we go through the process of research. Research is not very easy thing to understand. The word is very easy. It is just one word, research, re and search. So you are searching again and again, but the steps involved in research are not always very easy, and many things which involve. And basically there are four things which involve in research process. The first thing is called as preparation. See, because before conducting the research or before doing something or before executing something, I need to prepare myself. I need to gather many things. Maybe the drugs need to be procured. Maybe the instrument need to be procured. Maybe the people need to be, people need to be gathered, because if I am conducting the clinical research, I need the patients. So all those things, they come under the category of preparation. So the research has got four main areas. The first one is preparation. The second one is accessing, the third one is processing, and fourth one is transfer. The transfer is nothing but, as I told earlier, transferring the knowledge to the scientific community or communicating with the scientific community. That is the last phase of research, that is to transfer, right? The first one is preparation, accessing, processing, and transfer. These are the four different areas or four main basic areas of the research. Under the first step, that is the preparation, there will be, I have to define what is the area of my research, and what I need to explore, what I need to identify, and what I need to relate. These four things, I repeat again, under preparation, define the research or define the area of research which has to be conducted now. Then explore what are the possible different way of conducting the research. Identify the area where you can do it, and then relate. So these are the four basic steps which come under the category of preparation. Then locate, select, gather, and collaborate comes under the category of accessing. Analyze, evaluate, test, sort, and synthesize. This comes under the category of processing. And ultimately, revise, present, reflect, transfer. This comes under the category of transfer. These are the four different areas. So unless a researcher he goes through all these areas which have been mentioned here, till then the research process will be incomplete. So let us discuss about some areas of Ayurvedic research. There are basically few things which we call are the hotspots of Ayurvedic research. So even the central agencies like CCRAS, Ayush Department, Department of Biotechnology, Department of Science and Technology, they give lots of funds. Okay, they say they have lots of funds for research areas, and they have classified or they have categorized depending upon the priorities. And they say these are the first priority areas. If you choose anything under first priority area, we will give you more money or we will fund you more money. Like it's that the first priority areas, second priority areas, there are many things like that. But however, we have to think about the hotspots. Hotspots are nothing but what is the more problematic one or what is the more problematic disease or what is the more problematic health condition or a health aspect which the human race is presently suffering from. So those are called as hotspots. So depending upon those particular areas of research, some Ayurvedic research which can be conducted. So research related to the causation, efficacy of rasayana. See, these are the some areas or hotspots for which we can receive the funds from central agencies. Swasthavrata for prevention. Now the COVID, so far the lockdown was imposed with the idea so that to minimize or to reduce the spread of this particular disease because it is an epidemic disease. But however, the preventive aspect is also always also it is as good as the cure. To prevent some disease is better than cure always. So Swasthavrata for preventive is also it comes under the very important area of Ayurvedic research. Understanding samprapti of the disease, because even with the take an example of the COVID-19 itself, day wise or day to day, some new theories were postulated regarding the origin of the virus, regarding the transmission of the virus, regarding how it affects the human beings, what are the different signs and symptoms, what is the cause for death, everything. The different theories were postulated because nothing was very clear. So in Ayurveda, this kind of thing, what we say is samprapti. Samprapti is starting from the causative factors until the complete onset of the disease. What are all the systematic or schematic change which happen in our body? That is called as samprapti. So understanding samprapti of the disease process is also very important. So it is also been placed under some areas of Ayurvedic research. The assessment of risk factors, several studies to determine the association of dhatu status and vyadhikshamatva. These are all very important. They have been very important during present days. Prediction of diseases and proneness and many other areas need systematically designed observational studies, and many of these research methods are useful for newer hypothesis generation and testing. So especially Rasayana, the old age problems, the preventive aspects of the diseases, understanding the disease, that is samprapti, and assessment of risk factors. These have been becoming the key areas of Ayurvedic research. Now, how this Ayurvedic research happened? This is in your syllabus. The research methods of Ayurveda. These are the 5 different research methods of Ayurveda. Please note, the Ayurvedic research, as I mentioned earlier, it started with repeated observations, and especially they have observed the nature, they observed even the animals and their behavior, their food habits, and then they started thinking about the effect of the drug or effect of the medicinal plants on human beings. So it is because the repeated observations which the acharyas did and judgment of properties. Once they observed, then they started judging about the properties. Then they applied the things clinically. As I told, if you take the example of Guruji again, they observed the animal suffering from fever, which ate Guruji, maybe by mistake, but however, it ate that particular animal consumed the guduchi, and eventually the jwara subsided or the fever subsided, right? That it is they observed first and they judged the properties of the or is was hypothesized or they imagined that particular plant may be having Jwaragna activity. Then they applied that particular the same plant clinically, that is on human beings, and they started writing it or they started noting it. And what they noted their own observations because they have applied the knowledge clinically. They have given the plant to the human beings and they started noting in what form it has to be given and what is the effect when the guduchi, which is given in the form of swarasa, which is given in the form of churna, which is given in the form of kashaya, which is given in the form of hima, or which is given in the form of panta. So the role of guduchi on the body or the effect of guduchi on the body in different disease status in a different way, that is called as meticulous documentation. The fourth process, what they followed was meticulous documentation, and they just they did not stop there itself. They had revalidated the same things by multiple trials. Okay, so these are the 5 different steps which might have been applied during those era, maybe the steps involved in Ayurvedic research, and the same steps they hold good in the present day also. So the shloka which is given or mentioned by Charaka, that is Siddhanto nama sayaha parikshaye parikshakaihi bhuvidham parikshaha hetu vishcha sadhayitva sthapyate nirnayah. That means the things need to be analyzed, experimented, bahuvidham pariksha, experimented in a different way, experimented in multiple times, and then you have to establish the hetu, that is the karana, and the relationship between the karana and the karya need to be established, and the conclusion should be drawn. The sthapyate nirnayaha. Nirnayaha means the conclusion, because the end part of all research activities is nothing but conclusion. We need to write the conclusion ultimately. So when the experiments, when the research is conducted multiple times, it's called as revalidation through multiple trials. When the research is revalidated through multiple trials, then only we can conclude something regarding the effect or regarding the research, this one, the methodology which is employed and the results what we have gained. So example, the guduchi is repeatedly given. So few research which has been done in or on the medicinal plants and which they have entered ultimately as the drug, even which is recognized by modern science. Okay, even the modern practitioners also using them. Is one example is guduchi. The second example is Katukara, and there is Arogya Pacha. One more, which is Arogya Pacha. See the history of Arogya Pacha, which has been reported to be used by the tribal people in 1987, and because of the various trials, experiments, clinical trials, ultimately it entered into the market. And one more thing I need to caution, like whenever we tell about the research, it is not always that we get the positive results. The research may lead to the negative aspects also. Sometimes the research activities lead to disastrous effect also. And the present day, the COVID-19 vaccination, the trial is also not running very smoothly. Few people, they have undergone very serious adverse drug reactions. They have suffered from adverse drug reaction. I heard that one of the ministers who had received the vaccine, who developed the symptoms of COVID-19 and ultimately was shifted to ICU. Now, the same thing which happened with the medicinal plants also, and so both positive as well as negative aspects will be there with the medicinal plants. We need to analyze properly, otherwise the same research will be disastrous. Now this one is the classic example, that is Vidari Kanda. Everyone knows, especially the second year, third year students know it very well. This Vidarikanda, that is Pureria tuberosa. Now, in the text, why I am taking or why I am giving this example? Because in our text, there are many things which are mentioned. So many medicines are mentioned, many medicinal plants and plants are mentioned, and the possible way of their usage is also mentioned. But unless we understand the efficacy of that, or unless we understand the pharmacological activity of those medicinal plants, it is not quite smart to use these medicinal plants always, because the medicinal plants may prove disastrous if not used properly. That's the reason why in previous slides I have mentioned that is the fifth step of Ayurvedic research is revalidation by multiple trials. Unless it is revalidated, the research activity will be incomplete. Now coming to this particular story, what has happened? What happened was, because this particular medicinal plant is used, or sorry, in the textbook it has been mentioned as Vajikara or a Vrashya Dravya in the text. And the same thing, the drug was taken for research in the Jamnagar University in the year 1996, and they have tested the efficacy or effect of Vidarikanda Churna on human beings for its Vajikara activity. But the results were shocking. They did not get the result as per the expectation, but the opposite was noticed. The very shocking result. What was found that the Pureria tuberosa reduced the semen volume, spermatozoa count, reduced the spermatozoa count, and increases the total abnormal. Even the whatever the spermatozoa were there, they became abnormal. And it also reduced the sexual desire and erection. And during this treatment, 3 patients even developed the gynecomastia with an increase of serum estradiol level by 20 times. The conclusion drawn with this particular research, see, the research may be good or bad. As many good researchers are there, more than that, the bad researchers are there. And the good researchers are published, the bad researchers will never come into publication. That's the reason why we are not informed regarding those bad researchers, because they hardly come into publication. But however, this particular research finding was published and publicized. Because of this research finding only, we'll come to know whether to use Pureria tuberosa on male patients or female patients. Right? Actually, the Pureria tuberosa is having Vajikarana activity or Vrashya activity is correct. There is no doubt in it. And the text, what has shown or what has mentioned, it is having Vajikara activity is correct. It's not incorrect. But on whom? That's a big question. Definitely not on male gender. It is having a Vajikara or Vrashya activity on female gender, because there is increase in serum estradiol. Serum estradiol is nothing but the estrogen content. So when the estrogen is a feminine hormone, it is not a masculine hormone. When the estrogen content increases in the male gender, definitely they develop the feminine qualities. So the result, though it has given the negative result on male patient, but actually the conclusion to be drawn is the Pureria tuberosa is not at all a drug to be used on male gender. It has to be used on female gender. Though the research was incorrect, the research was a bad research, but however, it gave or it threw a limelight on what the plant is meant for. So nowadays, the regular research process is not to be employed. One or the other mistakes usually what we do in Ayurvedic research is we just follow the steps involved in modern science, and whatever the modern science says, the same steps will be taken for the Ayurvedic research, but this one usually fails. Okay? The same steps are not suitable for Ayurvedic research. There is something which has been defined by the doctor of modern science himself. Ashok B. Vaidya happened to be from Gujarat. I met him in Mumbai 8 years back. That is the person who postulated that the regular process of research is unfit. It's not fit for Ayurvedic research. It is the pharmacological techniques to be adopted, not the regular pharmacological process. The reverse pharmacological process or reverse pharmacological techniques need to be adopted for the Ayurvedic research. As a beginner, the final year students, please note it. The regular research process or a regular pharmacological process is not a correct method for research activities. The reverse pharmacology, see, forget about the steps. It is a very vast area. But however, the reverse pharmacological step is nothing but the research starts with the clinical studies, because we have both the drug as well as the indication. See, as whenever I teach research methodology to postgraduate students, I tell them one thing, that we Ayurvedic people, or anybody, not just Ayurveda, the people involved with the natural medicine or the traditional medicine especially, we are very lucky. Why? Because we have a pre-fed data. It's unlike the modern science. In modern science, everything need to be researched out. Everything need to be researched out from a scratch. It's not so easy. In Ayurveda, we have a data source. We have samhitas, we have nighantus. Many things are there. We just need to find out which is suitable for us. Okay. The comparatively, the research activity is easy as far as the people involved with the traditional medicine compared to the modern science. But we will never succeed when we go according to the path which has been developed by the modern science. We have to develop our own methodology in Ayurveda, and that methodology is called as reverse pharmacology. Now, coming to the next area of the research, that how should be the research conducted, or what should be the criteria for good research. So it has been told, like, good research should be finer, F-I-N-E-R, finer. So the criteria, when do you consider the research is a good research? So only when the research is finer, that is feasible, interesting, novel, ethical, and reliable. F is pertaining to feasible. The research should not involve more money or should not demand more money. So that is feasible, within our reach, within our limitation. Then the research area should it should be interesting. It should create or it should generate the interest among the people. So it should be interesting. You speak about COVID-19. The research on I am doing or I am conducting research on COVID-19. So definitely it will generate, it will create an interest among the general public, because the COVID-19 is one which is harming, which is affecting the people nowadays. So Ayurvedic research, especially if we say I am conducting research or I am doing research on diabetes, I am doing research on hypertension, I am doing research on old age problems, I am doing research how to stop or how to postpone our old age. So definitely it will create an interest among the people, because more and more people are affected by these particular health ailments. The diabetes is affecting maximum number of people. More number of people are having increased blood pressure. The signs of old age is also becoming more prominent among the younger age group. So if you do the research with Ayurvedic medicine, definitely it will create the interest among the general public. So the research should be feasible, it should be interesting, and it should be novel. So your idea should be the new one. So I cannot conduct the research by using the old ideas. So if I say that I do conduct research with penicillin, and definitely, or I do conduct the clinical trial by using penicillin, definitely the idea is not novel, because penicillin is good old medicine which is already known. There is nothing new in it. There is nothing new to establish the efficacy of the penicillin, or nothing new to establish the Jwaragna activity of Guduchi, because the Guduchi is good old drug. I know it, or people know about it. So then comes the ethical. Yes. The ethical part of the research is hardly discussed area. Nowadays, more and more importance has been given to this ethical part of the research. Though we are using the experimental animals, forget about the clinical studies. Clinical studies, there is a lot of the risk involved, because if the patients are harmed, If the study subjects are harmed, definitely the whole blame is laid upon the researcher. So, before the clinical study, the experimental works will be carried out on experimental animals, maybe rats, mice, frogs, rabbits, etc. But even for those also, the guidelines are there, the rules and regulations are there. I cannot catch hold of a rat and feed it with some medicine. It cannot happen. I need to take the permission that is from the competent authority, competent agency. I need to give them the details, how many experimental animals will be procured, how many experimental animals will be used, how many experimental animals will be ethically killed, or this is called a sacrifice. I should not use the word killed here, because after every experiment, the chance of animals living or chance of animal getting its right to live is equivalent to zero, because after the end of the experiment, none of the animals are left free. Definitely, those animals will be sacrificed, right? And how ethically I sacrifice them, with how ethically I give them a painful death. That is also been described under the rules and regulations. So the research should be, first of all, it should be feasible, should not demand more money, she should create interest among the people. The idea should be new, that is novel, and the research should be always ethical. And the last but not the least is the relevant. The research should be always relevant to the context. Now, the present day, the COVID-19 research is relevant. It is very much relevant, which is very much needed. If I say I want to do, or I want to conduct the research on smallpox, I want to conduct the research on any eradicated disease like polio, right? They are not relevant at all. There is, even if I do also, there is no value for that. Why? Because there is no relevance, because those diseases have been already eradicated. That's the reason I should take that particular area. I should choose that particular area which is very much relevant to the present context. So the research should be the finer, then only it can be called as a good research, feasible, interesting, novel, ethical, and ultimately it should be relevant. I don't go into very much detail of these particular things. You must know, I mean, you just have to remember these particular words. So, for example, whenever we speak about the Ayurvedic research, if at all, I spoke about diabetes, etc., etc. But however, the new ideas on treating Amavata, Sandhigata Vata, etc., they will be having more value. So, Amavata is something which affects more number of people. Sandhigata Vata is an age-old problem. So, if we can give some relief to the people who are needy people, then that particular idea can be taken as a novel idea. So always there is a quote in English that there is the chances of the presence of grass on the ground is minimal when more people walk on the ground. So you will not find any grass on that particular road when the people start walking on it. But however, walking on those particular roads will be easy, but it will not lead us to the new areas. So we need to explore the new areas always. Then only some good research can be, or good research results can be brought out. One of the article published in renowned Time magazine, whether the humans are guinea pigs or not, because the clinical trials, you may not be aware, the clinical trials especially which happen, which don't happen in the developed countries like America, Russia, and all those people will not allow the pharmaceutical companies to conduct the clinical trial. And where do the clinical trials are being conducted? The clinical trials being conducted in the third world countries like India also and African countries. And the people who are undergoing the clinical trials, the clinical trial will not be always, truthful. The clinical trials may give the negative results also. So let me tell you one statistics here. So as per the statistics, statistical calculation, the chances of a new drug reaching the people, okay, I repeat, the chances of new drug being reaching the people is 1 in 5,000. That is, out of 5,000 new molecules synthesized, new medicines produced, out of 5,000 new medicines produced, chances of reaching the people or a general public is only 1. You can just calculate the percentage of that. So only 1 in 5,000 researchers or researchers conducted in biomedical research, the biomedical field, only that will be a hit. Otherwise, 4,999 research will be the flop. You can imagine at what level those researchers fail. Let me tell you, many of the researchers fail at the level of clinical trials, because during clinical trial only, clinical trials are they are supposedly told to be the gold standard of the research, biomedical research. Why? Because ultimately we come to know the real positive as well as negative effect of that particular drug on human beings during clinical trial only. So during clinical trial process, many of the drugs or many of the new drugs will be eliminated, will be discarded. So the article was published whether the human beings are guinea pigs or not. Yes. Now, in your syllabus, there is something called as the process involved in the research. So, how to write a paper, and what are the different things which are involved in the paper. That is the title of the research article, aims and objectives of the research, then materials, then introduction to be given for the research, materials and methods, results, discussion, conclusion, how to formulate them, how to write them is something which has been told in your syllabus. But however, the research always starts with a good formulated question, the research question. So, how to write the research question has been told here. A poorly formulated question is Basti therapy, everyone knows. Okay, everyone knows that the Basti is, or Basti Chikitsa is also called as Artha Chikitsa, because Basti Chikitsa is the very prominent treatment to be given during Vata Roga. So Kati Shula is one among Vata Roga. So here, is Basti therapy useful in patients suffering from Kati Shula? This is a question, it's a good question, but however, it is called as, in a scientific fraternity, in biomedical research, it is called as a poorly formulated question. Though it is a question, but it is poorly formulated question. What's that? Is Basti therapy useful in patients suffering from Kati Shula? It's a direct question, but in research, such kind of direct questions are never asked. Then it comes like a well-formulated question. Well-formulated question is, does Basti therapy improve the quality of life in patients suffering from Kati Shula as compared to Virechana? Now, in the first question, I am just focusing on Basti therapy only, but there are other therapies also. When you give a choice to the patients, whether they want Basti or Virechana, over 90% of the cases, they choose Virechana, because Basti therapy patients hardly agree with that. But however, how the Basti therapy will be having more positive effect compared to Virechana. So the well-formulated question is, does Basti therapy improve the quality life in the patients suffering from Kati Shula as compared to Virechana? And a well-formulated question, again, a more is one improvised version, what we say is, improve the quality of life in patients suffering from Kati Shula as compared to Virechana. And I should even mention what kind of the study or what kind of a clinical trial I am going to conduct, because in earlier the type of clinical study is not mentioned. Before that, there is only the direct question. Is Basti therapy useful in patients suffering from pedicula? There will be only two answers, yes or no. But in second, a well-formulated question, does Basti therapy improve the quality of life in patients suffering from pedicula as compared to virechana? Here comparison is also there, and the question is more elaborated. But the improvised version of that particular well-formulated question, I am just adding the type of the clinical study also. That is, does Basti therapy improve the quality of life patients suffering from pedicula as compared to virechana? And then in bracket I write what is the type of study, that is a randomized open control study. Okay, what is randomization and everything is a PG level issues. But however, the type of the clinical trial or a clinical study must also be specified whenever the question is formulated. So a randomized open control study has to be added to it, or whatever may be the nature of the study. But when we mention the type of study with a question, then it is called as a very well formulated question. So it is also, I told that publishing a negative result is also important, because when I publish the negative results, okay, in research I get positive result and I get more of negative results. It's not that always I get positive results. More of negative results itself will be encountered, but they will be hidden, or they will be just suppressed. But however, there are many journals which have been coming forward to even publish the negative results also. So one such journal is the Journal of Negative Results in Biomedicine, the Journal of Pharmaceutical Negative Results. These are the journals which are meant for publishing the negative aspect of the research, or whatever the failures which have been encountered during the research activities. So publishing the negative result will help the future researcher not to commit the same mistake what the earlier researcher has committed. So this one is what is the one of the usefulness or advantage of publishing the negative results. So there are many things. Yes, and I think I am reaching the end part of this particular session. But however, without showing you this particular paper, I cannot conclude this my talk. This particular paper was published in very reputed journal. Even today, it is highly reputed journal. In those days, it was very reputed journal. The name of the journal or scientific journal was called as Nature. It is mentioned. You can see it on the screen. And this article was published during April 25th, 1953. And who published it? You might have heard. There were two researchers who were awarded with Nobel Prize in 1953-1954 for their elaborative study on DNA molecule. And they told us, or they told for the first time, they explained how exactly DNA is made out. So the double helical structure of DNA was particularly explained by these two researchers called as Watson and Crick. And this is called as Watson and Crick model of DNA, the double helical structure. And that particular article had only one, that's published only one page. The article may be only one page. You can see it, one or two pages, maybe some references are there, which is there in the second page, but only 2 pages article. However, research article of nowadays, we are at least writing 4 or 5 pages or something, it exceeds 8 pages also. If it is a review article, sometimes 10 pages, the article will continue along with the references. But however, here it's a research article which is having only one page. But even if it's a one-page article, it has received a Nobel Prize. So the content is more important compared to the volume. So we must understand the research, in research always the quality is more important than the quantity, or a content is more important than the volume. And the entire publication, because the publication is also there in your syllabus, I have seen it. So entire publication, which has been published by Watson and Crick, you can see on the screen just it has been classified, how in a different ways it has been classified. For example, the title of the research should be very much suitable. The abstract or abstract is nothing but the entire paper, the gist of entire paper, what we call as abstract. Then we need to give some introduction regarding, and introduction is, it can be also known as need for the study and review of literature. Together, the need for the study as well as review of literature, past and present circumstances, it comes under the introduction. Then methodology. Okay, the methodology is missing. They are not mentioned. The methodology or materials and methods need to be mentioned, followed by results. Materials and methods is nothing but how I did my research, how I conducted the experiment, what are the equipments we used, what are the instrument I used, which is the drug I used, in what form I used the drug, how many patients were there, how I assessed the results, okay, how the results are assessed. All these things come under the materials and methods. Then the observation and results, that is when I gave the medicine or when I administered the medicine to the patient, what are all the observations which were made, whether the observations or the positive observations or negative observations, everything comes under the category of results. And then comes the very important aspect of the research paper is discussion. Discussion is the area where I am going to discuss, I am going to relate what may be the possible reasons for the observations. Okay. If the Guruji is Jwaragna, again, I am taking the same example. What may be the reason for the Guruji to act as Jwaragna? I have to write it. That comes under the category called as discussion. And after discussion, I have to conclude. That is, whether Guruji is Jwaragna, what type of Jwara it is, what type of Jwara the Guruji can be used, and so many things. So ultimately, the research has to be concluded. So the research paper has got so many different areas you must understand. And regarding data sources, data mining techniques, I heard that these things have been already being told you. Yeah. So ultimately, just I tried my level best to give you some idea regarding the research definition, the types of research and how the research has to be conducted, and what are the types of questions usually asked in the research, and ultimately how should be the research paper and the different aspects of the research paper and how it has to be written. I hope it would be useful for you. With this many informations, if you read a very good book on the research methodology, definitely you will understand the things better. And I wish you all the best. Thank you.
Thank you so much, sir, for this wonderful session. Now this is the question time. So audience, anyone having any question, you can please ask. Or you can put your questions in the chat box. No questions?
No questions, always good old things which are told during our student life also. When there are no questions, There is only two possibilities.
I feel all the questions are being answered.
Okay.
Okay, well, it is now my pleasant duty to propose a vote of thanks on behalf of the institution and teaching staff. I express my sincere gratitude to Dr. Satish Pai sir for today's insightful session. I would also like to thank my colleagues for their support. I express my gratitude to our MD sir and our principal sir for arranging such an intuitive session and giving me an opportunity to host this session. Last but not the least, I thank all the students for their silent listening. Dear audience, a new year is like a blank book and the pen is in your hands. So it is your chance to write the most beautiful story for yourself. Once again, thank you one and all. Wishing all of you an amazing and magical year ahead. Thanks one and all.